to you, and what was your role, and what did you learn from it?
Okay, so I think the most meaningful one to me was the one did my first rotation in person. That was in America First Urgent Care, and my role in there was whenever a patient came, I used to take the patient inside. I used to take the vitals and ask the history and enter the details of the patient in the EMR. And also I did examination, and I consulted with the doctors regarding the patient's finding, and then he came with a proper plan, so we entered the plan and discharged the patient. I even helped with EKG and performing urine analysis. I even drew blood samples, and sometimes I would even make appointment for the patient. So that was the first time I got exposure to the US healthcare system, and I had worked with a diverse group of patients who didn't speak my language. And also we were a diverse group of medical staff as well. Two of the other externs were from Pakistan and one of them was from Bangladesh. So it was a totally new experience for me, coming from my home country and practicing medicine in a totally different setting. So I think I was always in a shell inside my home, and I could break that shell and finally come out of it and see all this diverse culture and everything in US. So I think that was most meaningful to me.
All right, that's great. My last question would be, I want you to share with me one of your case reports. You mentioned that you have some case reports. Mention with me one of them and why is it meaningful to you? And yes, just tell me more about your experience with it.
Okay, so I would tell you about a case report that I've written when I was doing a rotation with an endocrinologist. It's medical versus surgical management for Cushing syndrome, and we had two patients in there. And for the first patient was a 56-year-old man. He had hypertension and diabetes, and we had present with a unilateral incidentaloma, adrenal incidentaloma, and we had gone for a medical management. We had gone for a surgical management for that patient, and we had another patient which was 86-year-old female with other comorbidities like diabetes, hypertension, and hyperlipidemia. And she also had incidentaloma, but it was bilateral adrenal incidentaloma, and we had gone for surgical management for her. So in this case report, we tried to and tell about the different management of treatment, even though surgical management is the ultimate treatment of choice. But in case of comorbidities, or if the patient's age is very old, in that case we need to go for medical management as well. And we have tried this different modalities. It's not a complete end to the report, but we are still working on that patient.
All right. Okay. Thank you very much for your time. Do you have any question for me?
Yes. Thank you so much for asking me these questions. I would like to know that how receptive is the program for the residents' feedback?
Yes, that's a great question. So the program is really believes that the program development depends on the residents' feedback. That's why we assigned a team who look for the page for the residents' feedback and really work on achieving what they're expecting from us. So thank you for asking us this question.
Okay, thank you.
All right, thank you. So
Right time.
I think it was really good. Like we had like almost 20 minutes talk and you were really good. You answered every question. So before I dive into the details, I'm going to like comment on the general. I think like you have to show that you're enthusiastic about this opportunity. You didn't show any face expression. I know
Okay.
that this is just a mock interview, but if you didn't practice from the mocks, it will be hard for you to do it in the real interaction. So try to always show that you're interested, smile, and yeah, and just higher your tone, then lower your tone with some questions. I
Okay.
think this part is missing, but the questions. Let me just first go quick about the first question was tell me about yourself. You did really great, I think. My only comment would be that at the end you started to mention like a lot of stuff. Like I wanted to ask you about your hobbies, but you mentioned like a lot of stuff. You kept mentioning, you kept increasing this thing. If you just focus it on like two or three hobbies so that they can like collect the information and then ask you the second question.
And which questions?
I'm talking about the tell me about yourself. The
Okay,
last
I should
part,
mention about my
yeah.
hobby list.
Yeah, you mentioned like you gave me for in the beginning like two hobbies, and then you started giving me more hobbies. For example, you said that you're interested in scuba diving and YouTube channel. So just focus on few things so that they can ask you more questions. That
Later.
me,
Okay.
yeah. Then the second question was the last place you visited. You did really great. You shared your experience in Bali Island, and yes, it was great. And then the organization, whenever they ask you about an experience, you have to start by telling us your role. You should
Okay.
tell your role. I was doing this because they're really interested to see how did you contribute. Why did you become a doctor was really good. And then my next question, why internal medicine? And yes, it was also good. You mentioned that the continuity of care, and you mentioned that you during your clerkships, it was good.
Mhm.
So what makes you unique applicant? You said you're optimistic and your persistency. So I think they're unique stuff. I've never heard someone mentioning the things that you just mentioned. They're unique to you, so it's good.
Okay.
And the weakness was really great as well. But I suggest you started the weakness. You told me that a weakness that I have can you just start it by I used to have, because I think
Okay.
you, yeah, just say I used to be. Just
Okay.
make it in the past instead of something in the present. What are you looking for in a program? It was good as well. And then your US clinical experience. I had to remind you that you need to
Yeah,
tell
you're
me about.
asking about role.
Yeah, you have to tell about your role. And whenever they ask you about the clinical experience, instead of just mentioning a lot, you can first highlight, for example, I had 3 US clinical experience, but then focus on the one that is most meaningful to you so that you can tell me your role and how did you learn from it.
Okay.
And the last question is the case report. You also did it great. Yeah. You said that you still don't know the finding, but
No, actually, we have already given it for publishing, but since we have done medical management for that patient, but the treatment is still going on. I mean to say that because
I
for
just
the patient, we might later on go into surgery as well. But for now, we have planned this. That is what I meant.
all right, that's great. Just make it more like understandable to the
Okay.
interview.
Okay.
Yeah, but it was really great. Like,
I wanted to ask you when I talked to you about the role in urgent care, I said I did EKG and I took the patient inside, entered history and EMR. Was that okay?
um, yeah, it was good,
It
but
was a clinic
I,
setting, so I don't have any hospital experience. So all of my rotations are based on clinic. So they were a very sick patient. So I don't have any specific patient to talk about, but these were my roles: taking the patient inside and asking history, entering
yeah,
the.
I think it would be better, yeah, if you started by, for example, the way you started, you said I had a virtual, like the first one was virtual. I
First one
think you
was
could just add them all, sum them all. For example, if there are 5 experiences, say I have 5 US-based clinical experience without telling me that the first one is virtual. And then
okay.
like when you could lead by the history and examination because they show that you really worked. My roles included taking history, doing examination. I was also exposed to the electronic medical records. So just tell me something that might be really meaningful and might make you one step ahead from people who don't have internships.
Okay.
Yeah.
Maybe I
And
should avoid saying virtual rotation.
yeah, don't mention it because you have a lot of other rotations which are like real internships. So yeah.
Okay. Thank you.
Uh, you're welcome. So if someone else had any comment or feedback to her, he's welcome to give it.
Someone else, do you want to give feedback?
I agree
Yeah,
with him about the. Oh, sorry.
no. It's you're fine. No, I actually agree with what he said about the fact that when you were talking about your weaknesses, start with
Mhm.
something like, okay, my biggest weakness that I had to overcome was dot 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 dot. So this way, I feel like it. You tell the program that yes, you are human. Everybody has a weakness, but you have learned to overcome this over time.
Okay.
Yeah,
So I
that's
could
it.
start with past tense. I used to have difficulty speaking in public. Should
Yeah,
I
also
start?
the intonations, like he said, the intonations, your emotions, make it more real instead of everything. Like you're coherent. Everything you're saying is nice. Everything you're not like stuttering. You're not saying which is very good. But like he said, show more emotion up and down with the voice tone, so it looks more natural and sounds more natural. But you're doing great. So good job.
Thank you. Um, okay, Mohammed, should I start asking you questions then?
Yeah, I'm ready whenever you're ready. Yeah.
Mhm. Okay. Hello, Dr. Mohammed. How are you doing?
I'm doing great. Thanks for asking.
Okay. Can you tell me more about yourself?
Yes, absolutely. So my name is Mohammed Al Hussein. I was born and raised in Omdurman, Sudan. Sudan is one of the most diverse countries in the world. We have more than 114 native languages. And as a child, I was a leader to a soccer team. We won many tournaments. Our biggest achievement was winning a trip to the FIFA World Cup in Russia 2018. And as I grew up, I always wanted to give back to the community. I remember one time my dad was rushed to the emergency department after an accident. And when I saw the doctors save his life, I said, this perfectly aligns with my personality. And throughout my medical school, I was the vice president of the medical association. I personally gave lectures to the junior doctors and participated in many volunteering activities. After I graduated, I was always clinically active. And due to the low resources in Sudan, we tend to rely more on our clinical sense. That's why that sharpened my clinical skills. And I am also one of the 20% who matched into internal medicine residency in 2023. But practicing medicine in the US was always a dream to me. That's why I moved to the US and I was able to do internships and get to know the US healthcare system. Currently, I'm a research fellow at Michigan State University. I have presentations and publications with them. And during my free time, I enjoy watching and playing soccer. I also watch the NBA playoffs, to be more specific, and I enjoy natural scenery. Thank you very much for this opportunity.
Wow, you seem like a very interesting person. Can you tell me why are you interested in internal medicine?
Yeah, of course. I believe that I have numerous reasons why I picked internal medicine. Firstly, because as I said, I'm really interested in soccer, and I believe that internal medicine and soccer have many similarities. They both involve playing in a team and diagnosing the field and taking the right decision in the right time and having a holistic overview of the field of the field to reach a shared goal. So they both look alike for me. And the second thing is that I also like the continuity of care in internal medicine, where you get to meet the patient as an outpatient, and then you get to see him in the ward, and then as a follow-up. So you feel like internal medicine is a place where you really develop a patient-physician relationship, which is really one of the fundamentals of medicine. And the third thing is a story that happened to me. I remember one day after around about acute decompensated heart failure, I was on a trip to the rurals. So on that day, I met a man who was waving. As soon as I stopped, he was accompanied by his dad, who was lying on the back seat of the car. He was breathing heavily. I started taking history and doing examination. And luckily, I had my stethoscope on me at that day. So I was able to pick that the man has acute decompensated heart failure and then managed to transfer him to the nearest hospital and save his life. So these are some of the reasons why I love internal medicine.
Okay, that's really great. Since you said that you had already matched in 2023, is this your second year? Are you transferring
I,
somewhere or you are matched in Sudan?
I'm sorry, I meant I matched in Sudan, but I just wanted to stay clinically active. That's why I took the internal medicine residency in Sudan. And I matched, but practicing in the US was always a dream to me. That's why I moved to the
Have
States.
you already done your residency or not?
No, I've just matched, but I
But you
started
didn't take
practicing.
that option. Okay.
Yeah.
Okay, so since you said that you had already matched in Sudan, but why do you want to come to US then?
Because as I said, I wanted to stay clinically active because I believe for a doctor to doctors have to be clinically active. They have to expose themselves while they're applying for their main job. I know that from the beginning, I took my steps and I was preparing for the US. I know that US is my primary goal, but I wanted to stay clinically active. That's why I took the exam in Sudan. And I was practicing internal medicine, learning more. And that's even gave me more experience that I can put or give back to the residency here in the US.
Okay. What do you think are the challenges you are going to face during your residency here in US?
Now, that's a great question. I think one of the challenging things for every person is the transition. So for me to transition from Sudan to the United States, I know this is a challenging part, but luckily I had the chance to come earlier before the residency start. I was able to do internships. I was able to know more about the US healthcare system. I was able to get exposed to the patients and interact with them. So I was able to develop relationship. I was able to socialize outside. I feel like I'm here. I mean, I feel like it's home because I already know the people, and I always believe that in order for you to treat the people, you have to be one of them. That's why I believe that I'm one of the population. I found that the second language here is Spanish. I'm learning Spanish. So all this challenging feeling or fear of transition is now an excitement feeling. I'm really excited about residency at the moment.
Okay, that's really nice. Can you tell me about a difficult case you had seen during your medical career?
Yes, of course. So a difficult case was it was a 22-year-old male who presented to our during my internship year who presented to our clinics with he presented with depigmentations and swelling and neurological symptoms that range from headache and seizure. So he told us that he used to seek treatment for the last 5 years, and they always give him symptomatic treatment. For example, when he presents with headaches, they give him paracetamol, and that's all what they did for him. So after we first we were able to combine all the symptoms together because we know that you don't have to treat the patient as a symptoms. You have to like compile all the things. You're treating the patients. You're not treating the symptoms. So we were able to find out that this patient has a very unique disease. It was my first time seeing it. He had features suggestive of neurofibromatosis type A.
Okay.
And yes, was one of the most interesting cases because it showed me that you have to look at the complete feature, not only one symptoms.
Okay.
Yeah.
Since you talked about how much you like being in internal medicine and all this field, but I want to ask you, what is one thing you don't like about this field?
One thing that I don't like about this field is the low education in the underserved population. So if you ask me, like, if you ask me that if I want to improve one thing in internal medicine, I would do more. I would increase the role of the preventive care because I believe people from the underserved population don't get access to education or screening, and they have low income. That's why they tend to less likely know about the healthcare, and that's why they lead to them with presenting in like very late stage, and that's also might increase their chance of bad outcomes. So this is the one part I would want to improve about internal medicine. I would want to increase the role of internal medicine in educating more people, especially the underserved, so that they know about the risk factors and they can avoid the risk factors that can lead to late presentations and that can lead to detrimental effect on their health.
Okay. Can you remember any positive interaction you had with your colleague or your supervisor attending?
A positive interaction. Yeah, so um to be honest, I'm very friendly with everyone. That's why, like, the conflicts that I had were very few. I know that people face conflict, but there were very few. And if you ask me about the positive interaction that I had with one of my teammates is, yeah, I can say about my recent publication. So recently I've published an article about the use of automated external defibrillators in out-of-patient cardiac arrest. And I felt like because it was my topic and I was the primary author and I distributed the topic between my colleagues. So each one of them was only focused about his topic and he wasn't like focusing about the challenge. So the way I handled the topic until the publication, they were really astonished, for example, by the timing, because we were able to publish it in a short period of time and the outcome was really good. So they were all appreciating my efforts. So this is a time where I felt like, yeah, a positive interaction with my teammates. They were really appreciative and they were really happy by the outcome.
Okay, can you tell me if you had to work with any worst attending and how did you handle that?
A time where I work with an
Worst attend.
I believe that every attending or every experience that you pass through is a learning point. And to be honest, I believe that the goal of this medical field is to provide the best care for the patient. That's why you have to not focus on other things. For example, you don't have to focus on your personal gains, for example, to work with a person who's easy to work through. And to be honest, all the attendings that I worked with were very collaborative and they helped shape the person who I am today. But if I ever been exposed to the worst attending, I would first appreciate that he's a person who has more experience than me. That's why I will always listen to his feedback and always and yes, and always respect him. And maybe like I would, if there's something that happened that affected the patient care, I would have an open communication with him and share with him my point of view without crossing the red flags or without crossing the lines between me and him. So I guess open communication would be the key to working with difficult attending. And if we couldn't solve the solution, I would seek senior advice, of course.
Okay. Tell me about a time when you identified a patient safety concern or a medical error, and what steps did you take to address it?
All right, that's a great question. I'm going to take a few moments to think about a scenario or a patient encounter. Um, so could you please repeat the question one more time?
Sure. Tell me about a time when you identified a patient safety concern or a medical error was going to happen to that patient. So you identified that there was some medical error that is going to happen, and if such a situation had happened in the past or will happen in the future, then what will be your steps to address that?
All right, that's great. So the scenario that I remember is that one day one of my colleague had an emergency, so he had to leave the duty early. And on that day, the nurse called me that they needed a really emergent care to one of the patients, and they couldn't find my colleague, and they had to go to the ICU doctor. That's why they're calling, because they're worried that if this thing is repeated one more time, it might have a detrimental effect on the patient health. So what I did is that I reached to my colleague. I had an open communication with him, and he explained to me that he had a situation. I acknowledged his feeling, and I offered my help. And after I resolved the problem with my colleague, the thing that I made is that I made a WhatsApp group in which we had a handout. For example, no one can leave unless someone else is observing the patients. So I tried to fix the problem by doing like electronic handouts, where if a person had any emergency, he has to reach out to someone and before he leaves and tell him, so that there would be like an chemistry between the teams so that the patients get the best care.
Okay. Can you tell me about your strengths?
Yes, of course. So my strengths are, the first thing I would say, I'm a team leader. So throughout my life, I had many leadership opportunities. For example, as I said, my soccer team, I was the leader to it. And recently, as I said, my publication where I led the team and made them work efficiently and motivated until we have the publication. So this is one of my skills. The second thing I would say is I am a resilient I have resiliency. And since the time I graduated, my country have been in unstable conditions, which ended up in a war recently. And throughout all these years, I was able to balance between working and giving back to the community, and still focusing on studying, for example, to the steps, because US was my primary goal. So that's why I was able to balance between giving back and studying until I made it here. And the third thing that I would say I have is I am a team player. So also a nice example for this would be my ER experience, where I work with different healthcare professionals to achieve a timely and high outcome patient care. So these are some of my skills or my
Okay,
strengths.
I think time is up. Do you have any question for us?
Yes, I have one question. So I heard, or I've read in your website, that the program is expanding. I would really like to know the vision of the program in the next 5 years.
Okay, sure. So I don't know about the program. I'm not going to say anything on that.
No problem.
Okay, I'll start with the feedback. I really like your tell me about yourself. And I didn't know Sudan had so many languages as well. You told us Sudan had 114 something different languages, right?
Yeah, native languages. Yeah.
Yeah, that was really nice to know. And you talked about this World Cup as well. That was really nice. I think that was really interesting. You tell me about yourself. And when you talked about why I am, you even talked about a patient interaction. And I think you even talked about continuity of care. I like that as well. And when I asked you regarding challenges, uh, you said the phase of transition and the language, right?
Yeah, the fear of transition mainly.
Okay,
But
the fear of transition. Okay. Yeah, I think I never heard that fear of transition. I have never heard anyone say that, so that was new for me. So I think yeah, even that makes sense since you are coming from a different country and doing this here. So I think that was good. And you also talk about the language barrier that might be there, but you are learning Spanish, so that's nice. And I think I asked you regarding difficult case, and you went on to explaining interesting case. Is that also your difficult case?
I think it was because the diagnosis it's a rare like diagnosis. That's why it required a lot of work. I
Okay.
don't know if it works here, but
Yeah, I think you can see that. But at the end, if I ask you, I mean, if the interviewer asks you difficult, then maybe at the end say, so that was a really difficult case for us to diagnose. And if they ask you interesting, maybe give the same example, but say that since we don't see that case often, so it was interesting to see. But at the end, I since I was asking about difficult, and at the end you said interesting, so I got confused. Did I ask him interesting or difficult? So just make sure that you repeat the same word that they have asked. And okay, one feedback I would say, when I asked you why do you want to come to US, you said that you wanted to have that clinical practice, but even if you stay in Sudan and you had done your residency over there, you still have clinical practice over there, right?
yeah.
So I think you should talk more about why US, and you can talk about it has the best healthcare system and evidence-based medicine, and more regarding US. Because you said you want to continue clinical practice, but that is something you can do in any country. So I think focus more on US. And I really like the answer you gave for worst attending. You said that you didn't have such experience, but in the future, if such situation arise, then you'd like to appreciate it. I think that was really nice answer. And regarding the positive interaction, I think it was a good example since you talked about your publication, and through that, I got to know that you are interested in research as well. Also, you have that team leader role as well, since you said that you were the first author and you gave everyone instruction. So I think it also shows that you are a team leader and you are interested in research as well. So I think that's also nice. I think for safety concern and medical error, I think your example was good, but just try to rephrase it a bit more. And what did you say when I asked you what don't you like about internal medicine? What was that? I forgot.
I heard that because the I wanted the role of preventive health
Oh yeah.
medicine to expand. Yeah.
Oh yeah, you were saying that many people they don't have access to healthcare and you don't like that. Yeah, I think that also makes sense. Preventive care. I think preventive care is there, but yeah, you can say that some people don't have access to healthcare and you would like to increase that more. I think overall your interview was really nice. You were smiling and you looked excited as well when I was asking you certain questions. So I think that was nice. And at times you look serious as well. So I really liked your interview.
All right. Thank you for the good feedback.
You're welcome. Anyone else who wants to give back feedback to Muhammad?
Not really. He was really good at it. And yeah, like you have mentioned already that like there were changes in his facial expression, so that's a good touch. But apart from that, no, I really like the content that he had to say, especially about the attending doctor. Like if you had any disagreement with
Yeah.
anyone or there was a conflict of interest. So that was very nice, diplomatically put up. Good job.
Thank you.
Hi, good afternoon, guys. Can you hear me?
Yes, we can hear you.
Yes.
Afternoon.
Yeah, sorry for the background noise because I'm Equatorian. But Mohammed, everything was fine. Okay, you did very great. You have a great stories and you keep the eye contact and also smile and everything. I just want to mention something for you. You need to press and charge your answers because some of the answers was very long for me. For example, the why internal medicine it was a very long. Like you mentioned that your father and you mentioned you another patient who have heart failure or something like this. So I feel kind of bored about. Another thing about telling yourself, you confuse the interviewer by not saying what you are doing and what you are doing now. You say that you match it at your home country resident. You can forget about matching and saying like I'm starting my internal medicine residency back in my country, and then I take a time off to do a research job in the States. This is the story, right? This is what you're doing.
Yes, yes.
Because I didn't understand what you're doing now and what you have been doing. I don't know about your CV, but you need to mention what you are doing and what you are doing now. You thought that you finished the residency, but what I understand is that I'm from Lebanon, right? So you choose to do a residency, then you move it to the US, right? Just to clarify the things for telling about yourself. Like I did the residency, so I start the residency in my country, then I take time off to do a research in the state. Because I didn't understand that. I understand that because I'm a Libyan and I know what you are doing now. For them, they will not understand it. The another thing, she tried to challenge you about why the states, like she mentioned, you can't say that I want to come to the states and everything, and the system and well structured, the training is very good, they are advanced in everything. The strengths, I think it's generic. I mean, the strengths point. I want you to find another thing like leadership and resilience. You can imagine that the program director will interview more than 200. All of them, they will say the same thing. I'm leader, I'm resilient, I'm something like this. I think you need to avoid these generic strengths. Otherwise, everything was fine. You need to work on the stories, you need to share them, and you need to find some unique catchphrases.
That's a great feedback. Thank you for very much for all this information. I've noted everything. And yeah, I would work
Good
on
luck.
it. Sorry.
Good luck. Good luck.
Oh, good luck to you too. Thank you very much. So does anybody else wants to have an mock interview? If anyone wants to have a try, we can ask him. I can be the interviewer if you want. We can give him feedbacks.
Have the interview, but I'm afraid that I have a noisy background at the cafe. You can hear me very well.
Yeah, I think you have few background noises. If you can.
I can't manage that. I'm outside the room.
Oh, okay.
So I let
You guys
another
can hear.
person. Yeah,
Oh,
no, it's fine. I will let another person to do the interview. It's fine.
okay. Feedbacks. So yeah, apparently nobody else is ready. So.
Hello. Hello.
Hello, we can hear you. Yes, how are you?
Yeah, there's no one who wanted to. I can. Yeah, I would like to do a mock.
All right, we can ask you. Are you ready?
Okay. Yep.
Okay, let's do it. So good morning, doctor. Would you please help me? Anusha, is that the right pronunciation?
Yeah, Anusha, or you can call me Anu.
All right. So where are you currently living?
Right now I'm in Houston, Texas.
Houston, Texas. All right. Let's start by telling us more about yourself.
Okay. So firstly, thanks for giving me the opportunity to interview at your program. I'm Anusha. I come from a small village in southern part of India. I'm the first and only doctor in my family, in fact, from my entire village. Actually, this gives me a sense of pride and responsibility. I did my medical school from Rajiv Gandhi University, a well-renowned university in India. After my graduation, I pursued residency in dermatology, which has enriched my professional and personal skills. I worked for a couple of years as a dermatologist, and during which I developed the desire to enhance my knowledge and expertise in providing comprehensive care to my patients. This is when I went on year-long rotations in US healthcare. This is my professional journey so far. Apart from my professional life, I like to play throwball. I like to sketch, and recently I've started playing chess and trying new recipes. This is my, uh, professional personal life. I'm here applying for PG Live and position at your program. Interested to know more about you.
All right, thank you for sharing all this. Could you tell me more about one of your US experiences? You mentioned that you've joined a specific place. Could you tell me what was your role and what did you learn from this experience?
Thank you. So I had a year-long US clinical rotations in different settings, both in inpatient and outpatient settings. One experience which I would like to share was shares during the rotation in the Hemong department, where my role was I used to check take the history, do the examination, present the case, and come up with a treatment plan and discuss with my preceptor. I really liked this because we had a patient with who was treated with imatinib, a CML patient, and he did develop a DRESS syndrome, and I contributed in the team by coming up with the diagnosis and treatment plan. And I really felt that I was a part of a team, and I liked the collaborative work culture here.
All right, that's great. This is a really interesting case. What's the name of the syndrome you said?
Dress syndrome,
Dress?
drug reaction, dress.
Dress syndrome. Okay, all right. Yeah.
Yeah.
Okay. All right. So why did you become a doctor?
Yeah, this a very good question, I would say. Being a doctor is my goal since my childhood. As I've said, I come from a small village. I've seen the difficulty in accessing healthcare, and we used to have a doctor who used to visit our village once in a month, and all of us used to wait for the medical attention. So this was the time during which I was motivated myself that I should be a doctor. Yeah.
Okay, thank you for sharing this. Um, all right, my next question would be, you said that you sketch. Could you tell me about the last thing you sketched? What was it? And what type of drawing do you draw? Yeah, just tell us more about your hobby.
I sketch randomly like some cartoons or Mickey Mouse or anything. Not in specific or anything which I see. I like to sketch those.
All right, that's great. So my next question would be, what makes you a unique applicant?
Um, I believe you would be interviewing several outstanding candidates, but I feel what makes me unique is my extensive clinical experience and my home country, where I've come across diverse patient population. Because I've practiced in different states in India, this has helped my diagnosing and patient managing skills. And moreover, my unique clinical experience in dermatology would bring diversity to your program, and this could lead to an innovative approach. And secondly, my passion for providing comprehensive care to my patients, which will enable me to learn continuously and contribute to your program. And thirdly, I would say my year-long clinical rotations in US. I think this will bridge the gap between my experience in India and the residency here. With all these experiences, I think they have prepared me to strive during my residency and excel in being a good resident and a future physician.
All right. So do you have any weaknesses?
One weakness which I've been working on is my ability to speak in front of large crowds. I've been working on it since my medical school, where I've moderated during several events. And even during my residency, I presented my research papers in several national and international conferences. I would say this is a work in progress, and I believe I would have several opportunities during my residency training, which would help me in getting better, even more better.
Okay, great. You mentioned that you've presented research. Could you tell me about one of the most meaningful research experience to you? What was it about, and what was your role, and what was the outcome?
Sure. So among my research experiences, one which I would like to share is the effect of CO2 laser with the phototherapy and topical tacrolimus versus phototherapy and tacrolimus in patients with stable vitiligo. I took this project because we had several patients who weren't responding to conventional therapy, and that's the reason I um, researched several articles and came across this new treatment modality, and I worked on it. My role was to select the patients who were with stable vitiligo, see if they are satisfied by inclusion exclusion criteria, and perform the laser and do the review literature. The results were we found the patients who were with on CO2 responded well, and all my research experiences for now are in dermatology, but I recently started working on a new project, volunteering on a new research project in internal medicine. But I think my aspect of trying to explore new treatment modalities in helping my patients, which I've did in my past residency, will continue through my internal medicine residency too.
All right. And where do you see yourself in the next 5 to 10 years?
That's actually a good question. I would like to see myself as a competent physician, getting trained under a rigorous training at your program. After my residency, I would like to be a skilled primary care physician and an internist, and a hospitalist managing acutely ill patients. And I would also like to mentor the next generation physicians. Uh, uh, on 10 years down the road, I would see myself establishing long-term doctor-patient relationship, because I've had an experience during my rotation in New Jersey where one of the patients gave an interesting made an interesting observation that when he came for the first time to my preceptor, both of them were having the black hair, and he was like, "It's been so long that I lost my hair and your preceptor hair got gray." So actually, I really felt that this particular observation by the patient highlighted the patient-doctor relationship and the support and the trust which my preceptor had established, and he maintained it for several years. So I would like to have such a career where I can cultivate and I can maintain such a relationship with my patients. And personally, I would like to have build a family with 2 kids.
Okay. Tell me about a stressful situation you went through and how did you overcome it?
The most stressful situation would be for me would be during the COVID, as everyone had been through this. When I worked in a multi-specialty hospital, during that time, few of the physicians got sick, and all other department doctors, we volunteered in helping them manage. So my role was to triage patients in ER, manage the patients in wards, update the physician, and follow the orders, do the labs and report them. So I've seen several patients getting deteriorated, and one of the physician who got affected, even he got very critical, and this atmosphere made all of the other staff demoralized, and we kind of inspired each of us that this is the right time, we have to be motivated and to do best to the patients. Yeah, I would say this is a stressful situation which I've experienced.
All right. Dr. Anusha, I can see that you have a very good clinical experience. I'm sure that because conflicts usually happen in the medical field. Would you mind sharing with us a conflict you had with one of your teammates and how did you handle it?
Yeah, sure. One conflict which I had was during my first year of residency, when we had a patient, a 48-year-old patient with erythroderma, and my mentor asked to place an order for biopsy. But me and my colleague, we had a miscommunication between us, and we forgot to we didn't place the order, and the test wasn't done. So this made my preceptor kind of upset. But then I took all the necessary steps, performed the biopsy, and reached out to my mentor. And then I spoke to my colleague about all that thing which had happened, and we kind of sorted our misconception, and we tried to work effectively in team from then on.
All right. Thank you very much for sharing all this. Do you have any question for me?
Yeah. Two questions. Okay, I do have a question. I would like to know who, according to you, is a good resident. I mean, what qualities would you like to see in a good resident?
Mm-hmm.
And my other question is, is your program open to the feedback from the residents?
All right. Okay, great. So I think your voice, or overall, your voice was not clear. I'm not sure if it's because of the connection you have. I think that there's a problem with the voice. It's not clear. That's why I have to like focus a lot in order to
Sorry.
get the information. So yeah, we can just go through the questions. The first question was, tell me more about yourself. I personally feel like you don't have to like split it. For example, this is my educational and this is my personal life. You can just go with the flow and make it like a one picture. For example, I grew up in here and then I joined this university. So just include all the parts in just like in order. For example, yes, talk about your personal life, then how you grow up, then share about your experience, share about your hobby. I don't think you need to split it into two parts and telling the person this is my personal part and this is my experience. I don't know if
Sure.
yeah, maybe some people can share their overview as well. So then I asked you about your experience, what was your role and what did you do? I think you spent more time talking about a case that you encountered. But my question was specifically like, tell me more about your roles. So you said you take history, you do examination. Tell me, what did you learn from this? For example, I was able to know about the US healthcare system. I was able to learn about the EMR. Then you can like highlight a bit on that case and try to make it clear, because I've had to listen for 3 times in order to catch the Dress syndrome. Because sometimes sometimes if they didn't get the word, they might just like let you go. And here you're losing an important point, because Dress syndrome is really interesting. So you have to like make sure that you say the words in a very clear
Yeah.
voice that they understand.
I was using AirPods, maybe because of that. I don't know my voice.
Yeah, now it's way
That's
better. Yeah, now it's way better.
yeah, maybe I removed my AirPods now.
All right. So why did you become a doctor? I don't remember what exactly you said, but I remember that it was vague. It's not something like catchy. So
Okay.
yeah, I think you need to work on that question.
Okay.
Yeah. And the next question, tell me more about the sketch or a drawing that you had. You did good, but just prepare, for example, because they're really interested in the people hobbies and they want to know their insight. So they're going to ask you like this question. For example, tell me about the last drawing you had. Tell me more. Why did you draw this? So like just prepare something to tell them about. Make it ready so that you don't face difficulties making the sketch.
Okay. Yeah.
Then the next question was, what makes you a unique applicant? You said your diverse clinical experience, and then you expanded on this. You expanded that your experience is the thing that makes you unique. I personally believe that it should be 3. Like your diverse clinical experience is one of the things. That's all right. That's a great thing. Then tell me about 2 more things. For example, you could say your research experience, your adaptability. You need to make it 3 instead of 1, I believe.
Okay. So I can include right with my experience and my strengths, and I can like all together will make me a better candidate. Something in
Yeah,
that sense.
it's like I'm asking you about your strengths, and you said only one strength, your diverse clinical experience, and you were like emphasizing more on this point. Instead of
Okay.
like wasting a lot of time emphasizing on this point, you could add 2 points. For example, I have research experience, I am adaptable, or anything that you find unique. The next question was, do you have a weakness? You did good. Yeah, you did good. You explained it. And you told us how you overcame it. And then the research experience, yeah, it was also good. I liked it. Like you mentioned something, although it's not, I think it's related to internal medicine. You said it's a bit more to derma, but it's also linked to immunology, I think. It's also like linked to this part as well. So it's a good case, I think. So the next question was, where do you see yourself in the next 5 to 10 years? You said you're going to be a good internist and train in a strong program and all this thing, but you didn't give me like what's after residency, because I really want a person, or I really want an applicant who has a picture of what he's going to do. I don't want someone who's still lost till now. So you could tell, for example, if you're looking to start a fellowship or you're looking to become a primary care physician. So I think if you have a vision, that would be really, that would show that you really know what you're doing.
Yeah.
The stressful situation, you mentioned the COVID, which is a really good example, but like you didn't mention the difficulties that you went through. You mentioned that a lot of doctors were sick and this, but tell me, how did that affected you in person? What responsibility did that put on you? And what did you learn from this experience? This was missing as well. The conflict and how you handle it. This part, I don't know, maybe because of the airports, like you say, it wasn't clear to me till now. Like I didn't know if that scenario can be mentioned. I wasn't able to pick up all this stuff, to be honest.
Okay.
I think that's all what I have. If someone else heard, he can share his feedback with you as well. But overall, it was good, by the way. I just like to give like specified feedback. That's what I usually do to anyone. I give like question by question feedback.
Thanks a lot. Actually, this is my first mock, so I don't know how it went, and I don't know, I was so stressed.
Yeah, but it was. You're welcome. Yeah, you're welcome.
Can anyone give a feedback?
I think it was really good, but the feedback that he gave was that you can just work on that, but it was a good one.
Thank you. One more question I have, like, do I sound like prepared, or I don't know, was I too fast or something, or I'm okay?
It was okay, because now when you like, you're not using the AirPods right now, right?
Yeah.
I think now it sounds like your voice is clear. I think everything is clear. So I believe the difficulties that we had was due to the AirPods. But what I would just suggest, just one more thing that I remember. For example, when you're talking about something that is related, for example, to dermatology or related to immunology, just make sure that the person understands it. For example, don't say like, you've mentioned a benign tumor. I think you mentioned something OMA. Just make sure you tell me more about it. For example, this is a benign tumor of the vascular system. This is a benign tumor of the, like, just make sure to make sure that I am engaged in the conversation. Make it easier for me.
Okay. Yeah.
Well, yeah, you're doing great, I think.
Thank you.
Yeah, thank you.
Do you have any tips for in-person interview?
Yeah, even I have one.
Yeah, so in person is, I'm a little concerned, because online we have been having a mock, and yeah, so I don't know about the in person.
I haven't had an experience, to be honest. Yeah.
I've seen a video like where they were mentioning, if you have prior information about the APDs and PDs who you are interviewing with, that's fine. If not, it's better all the time not to look at your phone if you want to go through the information about the PD, it's better to use your phone in restroom. Yeah, because few of the programs, they don't give you information before. Like if it's an in-person, then that's so difficult. Virtual, usually they give the information before.
Yeah, they do.
Yeah.
They even give you who is interviewing you, but
Yeah.
I don't know in person.
I've seen a video like the lady, she was telling it's better not to use look at your phone all the time, and if you want to know the information about PDs or APDs, make sure that like if you did browse about them, make sure that you close the window, because if you want to show something in your phone and if they see that you are browsing about them, it doesn't look good.
No, I didn't understand what when are they particularly about saying about the phone? I mean, during the interview, during the in-person interview, or
Before and after, like, and between two, like we'll be waiting, like one set of people will
okay,
go
got
and
it.
waiting.
Yeah.
But
Okay.
I don't know, that's what I've seen in the video, but
Okay.
I would say so. I think we should consider as an in-person interview as something which an opportunity rather than an inconvenience. So you can impress upon many things there. So I think one thing which you can focus more on is the greeting etiquette and all the stuff, like how you interact with the people when you move around. So that thing you have much more opportunity while you're being in person. And the other thing is, obviously, you would dress appropriately to the in-person meet much more than the virtual one. And the other thing would be so how we walk around the place, how we observe the place, and all also shows how we are trying to look around the surroundings and trying to get a gist of it. Each and every thing or the whatever we do there is observed for sure. And as the doctor has pointed out, try to limit your screen time so that it shows that you are doing some stuff, even though if it is related to it, you're not trying to use an opportunity of being there. Rather, you're just looking at something in your phone.
Can we bring a paper and a pen during the interview, or we can just go with our nothing in hand, or what do we need to carry for just writing some important points? Can we take a paper and a pen?
Is it mentioned anywhere in the correspondence mails that you should not if it is
No.
specifically mentioned, and then I don't think that's an idea. The opportunity of a meet and greet before the interview, I think you can just ask it. You can ask a resident. Then if they're okay with it, I think you can just take it. It also shows an intent on your part that you are really interested to make notes of the impressions and whatever you want to write down. Yeah.
Oh, okay. Thank you.
It's a good thing, but it's like to be sure. I think you can just find it from the resident if it's okay.
Sure. Okay. Thank you.
How we will do in these type of situations, right? So for example, if they're asking you why should we choose you, right? Instead of like telling them I'm hardworking, enthusiastic, blah blah, and should we go with the example? Like, can we go with the example?
For sure.
Right? So that example should show some things that we avoid, like leadership role, maybe critical thinking, maybe communication skill, something.
Yeah, definitely. Like, I was actually asked that question. For example, if you worked in COVID, right, that's something unique about you. So start off with that. Be like, I can bring the exposure that I had working in a resource limited setting with COVID, and I can bring that to your program. Or, whatever quality, it's never about, oh, I'm this, because anybody can say that, right? Like anybody can say I'm a leader, but what shows that I'm a leader? So I need everything should be, every single thing you should say should be backed up with examples.
examples because they don't know you as a person. Maybe you know very well that you're a great leader, but they're just meeting you
Yeah,
for
but
the
I would say if your interview has already like a lot of stories, just do not make more stories while answering this question. Like
Mm.
I'm just say that because I have worked as a resident there, so I know how to work in limited resources. Because
Yeah.
I am a good team leader since I in my residency I used to make rota or I
Mhm.
used to lead a team. So keep it short. Just don't say a long story about that thing. I think that would get boring every time. Like every answer should not be a story to
Yeah.
me.
No,
Yeah,
I agree. But by yeah, that's what I meant. Like I didn't mean a patient
yeah.
story or
Yeah,
No,
yeah.
no,
just
yeah.
some
That's what
examples.
I second you. I second you. Yeah.
Yeah.
Just highlights.
Yeah,
All
an
right.
example.
Okay.
Yeah,
Okay. Okay.
Highlights. Yeah,
for
Mhm.
sure.
yeah. I'm hardworking because I have done this. I am a team
Yeah.
leader because I have done this. Just
Yeah,
like
for
that.
example, yeah, like I am sure everybody here is a very adaptable person because it is true that we're all coming from a different
Countries.
country. And,
Mhm.
yeah, so I use that example, like that you've been through 2 or 3 countries that you've moved or you relocated in your life, and that makes you adaptable. Just like short and sweet, but always
Yeah.
backed up, never like straight up. Yeah,
Gotcha.
other than that, it was great. It was very conversational and
Thank you. Thank you, Ramana. Good luck for your next interview.
Next.
So yeah. Okay. So should we start? I believe.
Yeah.
Okay. Hi, Dr. Rani. How are you? My name is Dr. Ahmed.
Hello, Dr. Ahmad. I'm good. How about you?
Great, great. So I have your CV here. Can you start by telling me about yourself a little bit?
Sure, of course. Dr. Ahmed, as you know, my name is Barkha Rani, and I was born and raised in Pakistan. I come from a very close-knit family of 5 people. That's my parents and we 3 sisters, and we all are doctors. I have graduated in 2014, and after graduation, I did 1 year mandatory internship. And following that, in 2015, after passing an entrance residency exam, I got exam where I completed my 2 years of internal medicine residency and 3 years of medical oncology residency. And after passing board exams, I was appointed in the same hospital as an attending physician and a faculty member as well. So during my residency, I was also able to write my MRCP exams and became member of Royal College of Physicians. But when I was working as an attending, I got married to my friend who was in US, and he's a pathologist here. And during our conversation, I got a lot to know about US. And as per customs, I had to move to US. And since that time, I'm working as a research assistant at Case Western Reserve University under supervision of Dr. Driscoll. And currently, I'm working with Dr. Naji Malit in Home Oncology Department at University Hospitals. That was about my medicine career. And outside medicine, I'm a very fun-loving person. I love to travel and I enjoy photography. I'm aiming to take classes of photography as well. And in my free time, I watch web series and do cooking. So yeah, that's pretty much about me.
Oh, that's very interesting about you, and you have lots of experience in your home country as well. Do you have any experience in USA working in clinical hospital?
Yeah, currently I'm shadowing Dr. Naji Malit at Heme Oncology Division at University Hospital.
So what have you learned from that rotation?
Okay, so basically, Dr. Naji Malit caters breast carcinoma patients. So we have been looking on breast carcinoma, and we have been dealing multiple cases of breast carcinoma. Yeah.
All right. Okay.
Mhm.
So can you tell me about what are your life goals now? What you're looking into next 10 years?
Sure. Dr. Ahmed, since I have background of hemato-oncology from my home country, I would like to pursue that in future as well. For now, after completing my internal medicine residency, if I perform well, I would apply for chief resident position as well. And then I would start my fellowship in hemato-oncology. And in next 10 years, I would like to see myself as an hemato-oncologist in an academic setting. And apart from that, I do have my family, so I have some responsibilities towards that as well. And I have few of the things in my bucket list. So I want to travel with my friend, so that's on the list as well.
All right, that's interesting. Well, I see that you are an old graduate, and while you are joining residency again, as you have completed it, so there can be many residents that will be younger than you, or many chief residents who will be younger than you. How will you'll be able to follow their commands and follow their instructions?
Right. Dr. Ahmed, this is very interesting question. Well, I believe on lifelong learning, and I'm very curious person. I have that urge in me to learn new thing, and I'm quite adaptable person. So I'm very hopeful that I would be adapting here and can work in a team. So since I have experience of working in a team as a team member and as a team leader, so I believe that I can work in a team in very efficient way.
Okay, that's interesting. Well, can you tell me about any interesting patient that you encountered in your home country?
Yeah, sure. So since I have done residency, so I was lucky enough to encounter very interesting and challenging cases. One case which I could recall is I was working in medical oncology when a patient who was diagnosed with lung cancer and he was on treatment with carbotidazole. He admitted in our ward with a complaint of diarrhea, and we had made an impression of chemotherapy-induced diarrhea in him. So we stopped chemotherapy and sent the cultures and DR. Although his chemotherapy was stopped and the cultures were negative, but his symptoms did not resolve. So following that, we took detailed history from him, and he agreed that he is having this diarrhea since longer time, and he had some of the features of malabsorption as well. So accordingly, we took gastroenterology on the board, and we sent extensive panel of investigations in him, and we also did endoscopy and biopsy. So as a result, his TTG levels were way higher, and the endoscopy with biopsy also confirmed the findings. So he was labeled as celiac disease, and as a result, we also involved dietitian for the proper counseling of what to eat and what not to eat. So in all this, what I basically learned was that we should keep our differentials very broad. So not every patient who is admitted on oncology floor is having chemotherapy-induced diarrhea or radiation-induced diarrhea. So there could be other reasons as well, and we should be very mindful about that.
All right, that's interesting. So, Dr. Rani, can you tell me in residency, what would you like to aid and what would you like to take from the residency, and what will you not want, but you will want not to have things on the residency?
Right. So I think that US residency is already very well structured. It is very well structured in terms of didactics, hands-on experience, and research experience as well. So what I would like to add is that some diversity. If the residents are from diverse places, so it is a very good thing. We get to learn a lot from different cultures, not only in terms of academics, but also in terms of their cultures, their cuisine. So that is one good thing about having diverse team. And apart from that, if the program has not research, so I would like to add a bit of research as the US world is moving so forward. So research should be included as well. So I think these are few of the changes which I would like to make, or which I would like to add.
All right, that's good. That's good. So I would like to ask you this question that while you're working as a resident on a floor and you see that two of the attendings are in argument, heated argument on the floor, and they are shouting, how will you go and solve that issue?
Right. So I think when we work in teams, these things do happen and these are inevitable. So I would like to ask them, and I would like to intervene if the issue is regarding patients and if the issue is regarding the management plan. So we can work in efficient manner, and we can sit down and have a talk about that, and if the issue can be resolved, we can resolve that issue by communication. I would like to open the doors of communication at that moment.
Okay. So do you remember any ethical dilemma or any ethical scenario that happened with you during any hospital practice with any patient or any colleague?
One thing which I could recall is it was not a ethical issue with my colleague, but it was some ethical dilemma, or I think where ethics were compromised was within the patient care. I could recall that when I was working as an internal medicine resident. So there is an epidemic. There was an epidemic of Congo hemorrhagic fever at that time. So there was a patient who came to me, and she was 42 years old, and she came in emergency department, and her platelets were 7,000. Although she was not bleeding from inside, but she had thrombocytopenia, and as an admitting officer, my plan was to admit her in isolation unit. But she was adamant of not admitting in the hospital and not staying in the hospital. So I think at that time, the beneficence, the autonomy of patients superseded the beneficence. I wanted to admit her to observe for any bleeding from any side. So I think that was the time where I think that my ethics were compromised and autonomy superseded.
Okay, I understand. So, Dr. Rani, can you tell me any of your volunteer experience that you remember was a very good according to you for yourself? Any experience?
Yeah, sure. So, Dr. Ahmed, when I was working as a medical oncology resident, and Pakistan is a very Pakistan is a developing country, and we have a lack of resources there. So, the chemotherapies are very expensive there, and we do not have insurance back in Pakistan. So the patient have to pay from out of their own pockets. So
everybody is on their position, so I am respectful to that part.
Okay.
So something like that, and you can just put in that way. So just enough, like keep it closing and in short things. All right. So this that way they can realize that there won't be any problem of adjusting to the environment as a resident. You're starting again.
Okay.
So other thing was other thing about the experience I asked you in the end, volunteer experience. You just told me about the things that you are doing. There you should mention learning experience, what you learned from that, right?
Okay.
You should include learning points and the important experience. The example that you told a person, they can talk to them, because as a first year resident, if you are going to talk to attending, then I think it's
what should be the proper answer for that?
Well, I actually don't know. Maybe somebody else should be knowing that, but I believe it should be something. I will be focusing. I will be, if I'm doing any patient related work, I will be focused on my patient. I will try to complete my role or my work. And if by any chance the patient care is being affected, I would not intervene directly to other attendings. It would be some disrespect. I would like to involve a chief resident or a senior. They better understand, and I will also like to inform the nursing staff so they are able to take care of the patients in the meanwhile time. And if the situation is getting worse, so I will, if I'm working in a program, I would must be knowing the rules of the hospital in those type of situations. So I will follow the hospital protocols and rules.
Okay.
Just close it. But
Okay.
obviously, yeah. So
Yeah.
just leave it to the PD. So you would be
Okay.
the only, because I think it will be not good to go and directly
No,
say
definitely.
anything.
Yeah.
So this was it. Other than that, tell me about yourself. I felt a little longer. It was good. You told everything about your. Tell me about yourself. So, but you can keep it. I think, yeah, I was able to listen everything, so it was good.
Okay. Was that getting boring?
Not boring, I would say, but I think it was. I think okay. Like 2 minutes was there, I think. So yeah, it was
Yeah.
okay. Mm-hmm.
Okay.
Yeah.
Okay. Was there
So,
any point which I can cut off? Like,
you can cut off something like that, detail about your husband. You just can say that my I got married, and I was always, I was always inclined towards the USA, the US healthcare system. I got this opportunity when I got exposure of the US healthcare system from my husband, who is currently working there.
okay.
Just completed. And then
Okay.
I also got the opportunity to get involved in the system, and I've been here, I'm in the system, I'm learning more about the system. And then let them ask you what you are doing in the system right now, I believe.
Okay.
So yeah, simply you can say like, I have been in the system, I'm currently working as a clinical research assistant, and just completed like this
Okay.
thing. Okay. So then they will be asking you the question, okay, you are doing research assistant where and with who, what you are doing.
Okay. I got your point.
Yeah. So just to highlight, that will be enough, I believe. So
Okay.
I think
Okay.
that should be it from my side. If anybody wants to give the feedback.
Thank you so much, Dr. Ahmed, for the feedback. Dr. Amna.
I'm so sorry, but I actually didn't listen because I was out of the room. So if anybody else was listening and has some feedback, sorry.
That's fine.
I have one feedback.
Sure.
Like good feedback. Like you when you are interviewing, you are keep smiling. Though that I noted very, like, it is good. Like program director will like your smile. So that's the good point I have noted. You are keep smiling, and yeah. So,
Thank you. I think that is it. It was nice doing session with you, Dr. Ahmed.